In many Indian families, the story is the same. A parent or a relative in their 40s or 50s suddenly falls on one side, cannot move an arm or a leg, and cannot form clear words. There is panic in the house. People search for a vehicle and rush to the nearest hospital. Sometimes the person reaches in time and some function is saved. Sometimes the damage is so deep that the person never walks or speaks normally again. Stroke is a brain attack. In a few minutes, brain cells that took a lifetime to build can die. What many people do not realize is that the seeds of stroke are often planted years earlier through uncontrolled blood pressure, diabetes, smoking, stress, and a lifestyle that never allows the body to rest. You may feel fine today and still be on a path toward a future stroke. I am Dr. Heartwise. In this video, I want to speak directly to working adults in India who are under constant pressure. You will see how stroke develops in silence, which early signs demand emergency action, and what you can start doing today in your own routine to lower your risk. Watch this as a serious medical lesson for yourself and for your family. If you already know someone who has suffered a stroke, keep watching and later share this video with one person who needs this information. In emergency departments across India, doctors are seeing more stroke cases in people who should be in the most productive years of their life. Some of them collapse at work. Some notice sudden weakness in one arm while brushing teeth. Some wake up with a twisted face and slurred speech. Relatives often think that this cannot be stroke because the person is still young. Precious minutes are lost while waiting to see if the problem goes away on its own. Stroke happens when blood flow to a part of the brain is suddenly cut off. In most cases, a blood clot blocks a narrow artery. In some cases, a vessel bursts, and blood leaks into the brain tissue. In both situations, the nerve cells downstream are starved of oxygen and energy. Within minutes, they begin to die. The part of the body controlled by that area of brain may become weak, numb, or paralyzed. Speech, thoughts, vision, and balance can also be affected. The brain does not have a spare copy. Once an area is badly damaged, it cannot be brought back to normal. Rehabilitation can help the person regain some function, but often life is permanently changed. A person who was working, driving, and supporting a family may now depend on others for basic tasks. This is why fast recognition and prevention are so important. Many of the strokes that we see are not sudden accidents from nowhere. They are the end result of years of high blood pressure, poorly controlled sugar, smoking, heavy alcohol use, excess body weight, high cholesterol, and constant stress. The body often gave warning signs long before the big event, but they were ignored or misunderstood. If this picture feels frightening, it should. Stroke is one of the main causes of long-term disability in India, but many strokes can be prevented or made less severe when people act early. In the next part, I will show you how common risk factors slowly damage your arteries and brain. If you want more people in India to understand this connection, press like on this video and keep watching until the end. Stroke rarely comes alone. It usually travels with a group of risk factors. High blood pressure, high sugar, high cholesterol, smoking, heavy drinking, central obesity, irregular heart rhythm, and chronic stress. On their own, each of these harms the arteries a little. Together, they create perfect conditions for a clot or a bleed in the brain. This part of the video connects these dots in simple language. Think of your arteries as flexible, clean pipes that carry blood to every corner of the brain. Blood pressure is the force pushing the blood through these pipes. When blood pressure is often high, the constant strong push hits the inner wall again and again. Over time, this lining becomes rough and damaged. At these damaged spots, fat and inflammatory cells begin to collect. Plaques form and slowly narrow the channel. Raised cholesterol adds more material to these plaques. High sugar levels in diabetes make the artery wall stiffer and more fragile. They also make blood thicker and more sticky. Smoking injures the lining directly and increases clotting tendency. Excess body weight, especially around the waist, releases chemicals that promote inflammation and disturb hormone balance. Chronic stress affects this entire system. It keeps the body in a half-emergency all day. Stress hormones raise heart rate and blood pressure. Sleep is disturbed. People under stress often reach for fast food, salty snacks, sweets, alcohol, and more cigarettes. They move less and sit more. This behavior pattern increases every major stroke risk factor. In some people, the heart rhythm becomes irregular, especially in a condition called atrial fibrillation. In such rhythms, small clots can form inside the heart. These clots can travel through the bloodstream and lodge in brain arteries. The result is a sudden stroke with no warning at the site of the blockage. If you have one or more of these conditions, high blood pressure, diabetes, high cholesterol, smoking, or a strong family history, take this seriously. These are not just numbers on a report. They are early steps on the road to stroke.
Use the comments to tell us which of these risk factors you are dealing with and what change you are ready to begin. If you find this explanation clear, share the video with a friend so you can support each other in making changes. Now we come to the part that can literally save brain cells and years of independent life. The early signs of stroke and mini-stroke. When these signs are recognized and acted on quickly, doctors can sometimes open the blocked artery and limit brain damage. When they are ignored, the chance of walking and speaking normally again becomes much lower. Stroke signs usually come on suddenly. The most typical pattern involves three areas: face, arm, and speech. One side of the face may droop or look uneven. One arm or leg may become weak or numb. Speech may become slurred, strange, or completely absent. The person may have trouble finding simple words or understanding what others say. Other warning signs include sudden loss of vision in one or both eyes, sudden severe headache, sudden dizziness, loss of balance, or trouble walking. These symptoms can be mild or last only a few minutes. Many people hope that rest will make them disappear. Sometimes the symptoms do fade within minutes or hours. This is called a transient ischemic attack or mini-stroke. It is an urgent warning that a larger and more permanent stroke can occur soon if nothing is done. A key point is that brain cells are dying minute by minute when a stroke is in progress. The earlier the patient reaches a hospital with stroke treatment facilities, the better the chance that clot-busting medicine or special procedures can reopen the artery and save tissue. Every hour of delay means more brain is lost. Traveling to a distant hospital or waiting overnight to see if the problem improves wastes precious time. Families should know the basic pattern of stroke signs: sudden face droop, sudden arm weakness, sudden speech trouble or confusion. Any one of these is enough to treat as an emergency. Do not drive long distances without medical guidance. Call local emergency services or reach the nearest hospital that can handle stroke. If you or someone in your home ever notices sudden weakness on one side, sudden face change, or sudden speech trouble, treat it as a brain attack and seek urgent help. Do not wait for hours hoping that it will settle. In the comments, you can write which warning sign was new for you today. Press like so that this life-saving information appears in more recommendation lists. If you want more clear explanations about brain and heart emergencies, subscribe to this channel and stay connected. We have talked about fear and danger. Now we talk about protection. You cannot control every event in life, but you can change the conditions inside your own body.
Small changes made consistently reduce the chance of stroke and can also protect your heart, kidneys, and eyes. A practical stroke prevention plan for a busy adult in India does not need to be perfect. It needs to be steady. The first pillar is blood pressure control. Know your numbers. If your pressure is raised, follow the treatment plan given by your doctor and do not stop tablets on your own just because you feel normal. The second pillar is sugar control. If you have diabetes, follow diet advice, medicines, and monitoring closely. Each step protects the delicate vessels in your brain. Third, keep cholesterol in check. Simple food choices make a real difference. More home-cooked meals, less deep-fried snacks, more vegetables and fruit, whole grains, pulses and nuts in moderate amounts. Fourth, move your body. Aim for at least 150 minutes of moderate activity per week, such as brisk walking. Movement improves circulation, weight control, and stress handling. Fifth, avoid smoking and limit alcohol. Tobacco in any form is strongly linked to stroke and heart disease. If you smoke, seek help to stop rather than waiting for a scare. Sixth, protect your sleep and stress balance. Regular sleep timings, short daily relaxation practices, and limits on late-night screen time help lower stress hormone levels. Finally, do not ignore warning signs. Frequent headaches, repeated episodes of brief weakness, short spells of confusion or vision loss are reasons to seek medical evaluation. Early action can uncover problems before a major stroke occurs. If you recognized pieces of your own life in this video, do not respond with fear alone. Respond with action. Choose one change you can begin this week, such as checking your blood pressure, walking daily, or cutting down on smoking, and write it in the comments. Your decision may encourage another viewer to move in a safer direction. If this lesson on stroke in India helped you understand your risk, press like so that more people see it. Share the video with one person who lives with high stress or high blood pressure. Use the comments to tell us which brain or heart topic you want us to explain in future videos. Subscribe and turn on notifications so that you receive the next clear and simple health lessons from Dr. Heartwise in time. Together we can prevent many strokes before they happen and protect years of independent life for you and your family.